Dear student, Assalamu alaikum. Today I want to talk about shock, or another name of shock is circulatory failure. Shock, what is shock? What is shock or definition of shock? Shock can be defined in several ways. Shock is generalized inadequate blood flow through the body. As a result, tissue are damaged due to low oxygen and other nutrients delivered to the tissue. Another way you can define the shock is a level of oxygen delivery which fails to meet the metabolic requirement of the tissue. In another way you can define the shock is a systemic state or state of systemic of inadequate tissue perfusion which is inadequate for normal cellular respiration. When we in decreased delivery of oxygen and glucose, cell changes its metabolism from aerobic to anaerobic metabolism. If the shock is not prevented quickly, the cell damage ensues. When the cell switches its metabolic pathway from aerobic to anaerobic, there is an increased production of lactic acid that will damage the tissue. But when there is a presence of oxygen, the tissue metabolic product is carbon dioxide and water. Carbon dioxide will be eliminated through the lung and water will be added in the blood and then it will be excreted through the kidney. Now what you have learned from this definition gives you a conclusion that oxygen is the essential for the metabolism of the body. That is, lack of oxygen or deprive of oxygen to the tissue develop shock. Before going to classification of shock or circulatory failure, I want to repeat definition of shock again. What is shock? Shock is the generalized inadequate circulation through the whole body. As a result, the tissue are damaged due to low oxygen or other nutrients delivered to tissue, or a level of oxygen delivery which fails to meet the metabolic requirement of the tissue, or a systemic state of inadequate perfusion which is inadequate for normal cellular respiration. Now come to the classification of shock, that is circulatory failure. Shock can be classified in low stroke volume or decreased cardiac output. Another is vasodilatation or distributive shock. These are the two headlines. One is low stroke volume or reduced cardiac output. Another is vasodilatation or distributive shock. In low stroke volume, shock are hypovolemic shock. Another is cardiogenic shock. Another is obstructive shock. Now, hypovolemic shock is the example is severe diarrhea. Now come to classification of shock. That is, another name of shock is circulatory failure. Now you can classify shock in two categories. One is low stroke volume or reduced cardiac output. Another is vasodilatation or distributive shock. Now, what are the shock includes to low stroke volume? It is the hypovolemic shock, cardiogenic shock, and obstructive shock. Now come to the hypovolemic shock. Example is severe diarrhea, severe burn, and hemorrhage. In severe burn, there is excessive loss of plasma. When plasma loss, there is developed the hypovolemic shock. Now cardiogenic shock. Example is myocardial infarction, mitral valvular disease, and cardiomyopathy. Third one is obstructive shock, is the pulmonary embolism, cardiac tamponade, and pneumothorax. In pulmonary embolism, that is pulmonary artery will block by embolus, then blood cannot go to the lung to take up of oxygen by the lung. Now, what is cardiac tamponade? You know the heart is covered by pericardium. Pericardium having two layers. One is visceral layer, another is parietal layer. In between two space, there is a potential space. That space is occupied by fluid and blood sometimes. When the fluid and blood accumulate inside the potential space, heart cannot expand. That is, end diastolic volume will be reduced. Now the pneumothorax, when positive pressure that it compress, if air in the parietal pleura and visceral pleura, that is collapse the lungs, and lungs cannot transmit the oxygen in the blood properly. Now come to the vasodilatation or distributive shock. These include septic or SIRS, severe inflammatory response syndrome, then anaphylactic shock, then neurogenic shock. Now septic or SIRS example is severe bacterial infection. Anaphylactic shock, that is example is bee sting and drug reaction. Neurogenic shock can be developed by spinal anesthesia, general anesthesia, and spinal injury. What are the pathogenesis of distributive shock? This is the inadequate organ perfusion is accompanied by vascular dilatation with hypotension and low systemic vascular resistance, peripheral resistance, inadequate afterload, as a result, abnormally high cardiac output. Now come to the septic or SIRS. Example is severe bacterial infection. In severe bacterial infection, endothelial tissue will not get nutrition. There will be that causes damage of the endothelium, and plasma will come out from the capillary, and that is the cause of shock. Anaphylactic shock, example is bee sting and drug reaction. In this case also increase the capillary permeability, and therefore loss of plasma from the capillary, and there will be development of shock. Neurogenic shock, example is spinal anesthesia, general anesthesia, and spinal injury. In neurogenic shock, the decreased peripheral resistance as well as vasomotor tone. As a result, there is a dilatation of the blood vessels, the increased blood pooling in the venous system that will cause the shock. Now, I want to explain some shock. Sometimes tissue is on shock, but blood pressure remains normal. Therefore, blood pressure is the late manifestation of shock. That is, fall of blood pressure is the late manifestation of shock. Now, again, hypovolemic shock. Hypovolemic shock, The symptoms is sign and symptoms is rapid thready pulse and skin is cold and clammy. And hypovolemic shock is another name is cold shock. Another name is cold shock. The question might arise, which one is the warm shock? Warm shock is the septic shock. That time the skin become warm and skin blood vessel is dilated. And first I mentioned that shock and hypotension is not synonymous, because in shock there is a fall of blood pressure, but it has a late manifestation in some shock. Suppose if you are posted in remote area, how you can determine the shock? If you ask the patient how much the volume of urine, in shock there is a reduced production of urine. But if you in urban area, there is a investigation support, then you will determine the serum lactate, because there is a lactic acid production, and there is a reduce the base bicarbonate level. Thank you. Now I am to tell something about Bangla. Dear student, আপনারা সবাই বাসায় থাকবেন, চিন্তা করবেন না, পড়াতে মনোযোগ দেন যতটুকু পারেন। ইনশাআল্লাহ আপনাদের সাথে আবার দেখা হবে ইনশাআল্লাহ। আজকে এখানে থাকুক, আপনারা মনোযোগ দিয়ে পড়বেন।